Motion number 4 on medicines. I call the Minister to move the motion. Minister Karin Smyth.
Thank you, Madam Deputy Speaker, and can I add my congratulations to your election. It really is a pleasure to see you in the chair this evening. I beg to move that the draft Human Medicines Amendment relating to Naloxone and Transfer of Functions Regulations 2024 be approved by the House. This draft statutory instrument proposes amendments to the Human Medicines Regulations 2012, which will expand access to naloxone, a life-saving medication which reverses the effects of an overdose from opioid drugs. In addition, it makes amendments to keep the regulations current by updating references to Public Health England and the Health and Social Care Board following the dissolution of these bodies. Honourable members will no doubt know the devastating impact that illicit drugs cause. Drugs destroy lives, tear families apart and make our streets less safe. Almost 3,000 people died of drug misuse in England in 2022, which is the highest number since records began in 1993. Drug misuse deaths have doubled over the past 10 years, and we know that people who die from drug misuse do so at a tragically young age, often in their 40s. Almost half of drug misuse deaths in 2022 involve opiates such as heroin. These deaths are avoidable. Dedicated drug treatment services provide the path to recovery, and my department is continuing to invest in improvements to local treatment services that have faced significant cutbacks in the past. However, we also know that over half of people struggling with opiate addiction are not engaged in treatment at all. This means that significant numbers of an incredibly vulnerable population are at increased risk of accidentally overdosing and dying. People who experience addiction often have multiple and complex needs, and we know that there is a strong link between addiction and deprivation. The rate of drug misuse deaths in the most deprived areas of England is almost 3 times higher than the least deprived. Nearly a third of people in treatment for drug or alcohol problems reportedly have a disability, around 1 in 6 have a housing problem, and around 70% have a mental health treatment need. Tackling this issue supports this government's health mission, ensuring people can live longer, happier lives, as well as our collective efforts to break down barriers to opportunity and create a fairer society. Naloxone is a highly effective antidote against opiate overdose. It can be administered quickly and safely by anyone in an emergency. But currently, exemptions in the Human Medicines Regulations targeted at specific providers only specifically enables supply by drug and alcohol treatment services, which limits the reach of this life-saving medicine. Widening the statutory framework will mean more services and professionals are able to supply this medication. This means easier access to it for people at risk and for their loved ones. And honourable members, in short, this legislation will save lives. We're already seeing the benefits of professionals outside the health service, such as police officers being able to administer naloxone. North Yorkshire Police have already saved 7 lives since April, when naloxone was rolled out across the force. This draft instrument being debated here today proposes 2 key UK-wide changes to existing regulations. Firstly, to expand the list of services and professionals named in the regulations who are able to give out naloxone without a prescription. In short, this means that professionals such as registered nurses and probation officers will be able to provide take-home supplies of naloxone where appropriate, should they wish to do so. Secondly, we propose to establish national registration service across the whole of the United Kingdom. This will enable all other services and professionals who are not able to be named in the legislation, including housing and homelessness services, to register and procure naloxone, subject to passages of this statutory instrument. I look forward to working with colleagues across devolved governments on this. I want to thank them for their work to date and continued support on this important issues. I want to reassure honourable members that with these changes we are not compromising on safety. This is an extremely safe and effective measure, even when administered by a layperson with no prior experience. It only has an effect if the person has taken opioids and is already widely used across the UK and internationally. We are taking steps to mitigate against any very limited risks associated with wider access. We will provide updated guidance for services in scope, and we will set out robust requirements for training and safeguarding. These new powers are enabling but not mandatory. The intention is not to create new burdens for services, instead to provide an opportunity provision based on local need. I'm confident in the support for these changes across sectors, evident in the responses to my department's consultation earlier this year, with over 90% of respondents in support. In taking these changes forward, I'd like to recognise the long-standing calls for these changes amongst experts in the area. For instance, the Advisory Council on the Misuse of Drugs is an independent expert body that advises the government on drug-related issues in the UK. In 2022, they published a review of naloxone implementation which called for more work to widen access to the medication. Similarly, Dame Carol Black's independent review of drugs also highlighted expansion as a vital harm reduction measure, and I would like to thank and pay tribute to Dame Carol for the work she has done to drive improvements in drug treatment and recovery, and express my gratitude for her continued advice and expertise. The importance of this work only continues to increase as time goes on. Honourable members may be aware of the growing threat posed by synthetic opioids. These synthetic drugs, such as nitazines and fentanyls, are often more potent and more deadly. The government has taken a range of steps to prevent the rise of these dangerous drugs in the UK, but the availability of naloxone will be vital to our ability to respond and save lives. Honourable members, addiction is not a choice. It is often fuelled by wider issues such as trauma and housing instability. This is a complex public health issue and must be tackled as such. We must change the narrative on addiction to one that is about preventing drug use, reducing harm and enabling recovery. The changes this legislation proposes to make are simple and low risk but have the potential to save countless lives, and on this basis I recommend the regulations to the House.
The question is as on the order paper, and I call Shadow Minister Dr Ben Spencer.
Thank you, Madam Deputy Speaker. And it's not often that one speaks and changes the law in this place, and the direct result of which will be to save someone's life. And we expect, once these are passed, and I hope they'll pass this evening, many people's lives. Today is a very special occasion. And public health, at its core, isn't flash. It's not sort of pizzazz. And I say that with no sort of disparaging to people who work in the public health industry. Public health is incremental changes that make real difference and change to people's lives and have ongoing cumulative effect. Naloxone reverses the effects of opiate intoxication or overdose. It's a drug which stops people dying from heroin overdoses, accidental overdoses, and deliberate overdoses of opiate medications and opiate drugs. It is quite literally a life-saving medication, and accordingly, it's one of the World Health Organization's essential medications. Now, if you'll indulge me, Madam Deputy Speaker, on the subject of naloxone and its use in treating lethal overdose, tomorrow is World Suicide Prevention Day. And in advance of tomorrow, I'm pleased that we're supporting and debating a motion today to expand the access and administration of a vital antidote for opiate poisoning. Suicide is the biggest cause of death in men under the age of 50. The stats change and vary, but when I looked at it earlier just to see the most recent stuff I could find, or the best data I could find, that's where it's at. Around 3/4 of deaths from suicides each year are from men. And I've also read that it's the biggest killer of the under 35s, impacting people from all walks of life, with many people affected personally by deaths from suicide. On World Suicide Prevention Day, we remember all those affected by suicide and the work we need to do to reduce suicide through public health measures and mental health service provision and treatment. Now, turning back to the SI in front of us, the use of highly addictive, lethal opiates, perhaps in combination with other substances, are often responsible for death as listed as a consequence of drug misuse. In 2022, opioids were involved in 73% of drug misuse deaths in England, 82% in Scotland. The last government worked very hard to make progress on reversing the upward trend in drug poisoning deaths. Our 10-year cross-departmental drug strategy, published in 2022, aimed to prevent nearly 1,000 deaths in England by 25, and naloxone rollout has been highly effective in reducing drug misuse deaths by treating the effects of opiate overdoses. Now, there have been several regulatory changes to expand access in the last decade. Under the last government, the human medicines regulations were approved in 2012 to regulate the supply and use of drugs in the UK. This was followed by further amendments in 2015 and 2019, which focused on expanding access to naloxone for emergency use. The last government then called on Dame Carol Black to lead an independent review of drugs policy, and I thank Dame Black for her work in this space, and indeed everyone working in this area, and those contributing to our consultation earlier this year, which I'll come back to in a moment. Now, one of Dame Black's key recommendations was to ensure that more individuals supporting drug users were able to access and give out naloxone, and I'm pleased that she welcomed the proposals to expand access to naloxone earlier this year. When we launched the consultation to seek views on improving naloxone access through named services professionals, as required by the Medicines and Medical Devices Act 2021, there was very strong support. With over 300 responses, a third from organisations, over 200 from individuals and professionals. Over 80% were supportive of improving access through named services professionals and introducing registration with a naloxone supply network coordinator. So I'm pleased that ministers have followed the direction of the last government in legislating to expand access to naloxone to more healthcare professionals and services, as they want and need. It will build on work across the UK to reduce the scourge of drug-related deaths caused by opioids. On this legislation, the government will have the support of His Majesty's opposition. I encourage all colleagues across the House to give it their backing. Now, of course, I have a question I'd like to ask the Minister in regards to the motion and yes side that we're debating earlier, which comes down to training, which I think is a critical part of this. And I remember at medical school and in my psychiatric training, one of the key things sort of instilled into my head about use of naloxone is that naloxone is a wonderful drug for the first 30 minutes, and then it starts to wear off. It's got a very short half-life, which is the time it takes to leave the body, and then the effects of opiate overdose can start to reoccur, especially with the long-acting opiates. So naloxone fixes the problem in front of you, but there's another problem coming down the track, and you need to make sure that the person has adequate treatment quickly so that you don't have the after effects when naloxone wears off. Can she reassure me in the work that she'll be doing to ensure that people who are giving out naloxone kits, who are giving naloxone, she mentioned earlier families and broader access in terms of homelessness charities, that component, that the training component of naloxone administration and aftercare is as secure as it can be to make sure we can do everything we can to avoid further drug-related deaths. Thank you.
I call the Liberal Democrat person, Bobby Dean.
Thank you, Madam Deputy Speaker. And it's good to hear that a consensus is building across the House on this issue because, as we've heard from other members already, naloxone is a lifesaver. Since its rollout in the UK, the highly effective antidote to opioid intoxication has doubtlessly saved hundreds of lives and prevented many more harmful overdoses. This has been known by organisations working in my community for some time. On the day my local branch of Cranston, a harm reduction charity, received its very first supply of naloxone, staff members had noticed that somebody was overdosing in the reception area. And as they were still unpacking the pallet, they were able to get access and administer the medicine, bringing that person back around and then able to help them further. So in hour one of receiving this vital medication, it potentially saved a life in my borough. And the local staff described naloxone as a game changer. And this is why I and the Liberal Democrats welcome the motion before us today to expand access to this vital treatment. Naloxone is not a difficult drug to administer. Just 30 minutes of training can be enough to equip somebody to treat a person in need. And naloxone is also low risk. The person administering it does not need to know for sure what drug somebody is on. If it is an opioid, then it will help. And if it's something else, then it's likely that it will do no harm. And this combination of it being safe and easy to use, along with its life-saving potential, means that with the correct training and provisions in place, it's common sense to get this into as many hands as possible. And this is particularly true given the frightening rise in our country of the use of synthetic opioids like nitazines. Now, most people will be aware of the dangers of one particular opioid, heroin, but with the crackdown on supply in Afghanistan, this new synthetic alternative is rapidly taking its place in the market. and nitazenes are estimated to be anywhere between 30 and 500 times as potent as heroin. This is scary, and it means that if we don't act fast, then we could be dealing with a national emergency comparable to the fentanyl crisis sweeping across the United States. And it is that urgency that means that in welcoming this measure, I must also take this opportunity to encourage the government to think quickly about potentially going further. The expanded rollout of naloxone to police, prison, probation and youth justice services is welcome. But I'd like to ask the Minister to monitor the success of this expansion closely, listen to those organisations on the ground, and keep under review whether it would be practical and desirable to expand access even further. Some charities have called for potentially taxi drivers or nightclub door staff to be able to have access to it if they want it. And of course that would have to go alongside the appropriate training to recognise things about the effects of it wearing off in 30 minutes' time. But if that appropriate training is in place, we should look to potentially expand access further still. And if we build this evidence case, we can then be led by it and make sure that harm reduction measures are reaching as many people as possible. And going further also means taking a whole systems approach to drugs policy, from appropriate sentencing to investment in addiction services and other specialist support for users. We have tried the tough talk, we have tried the wars on drugs route in this country, and it has left us with one of the worst rates of drug-related deaths in Europe. So a move such as transferring the departmental lead on drugs policy from the Home Office to the Department of Health and Social Care would go a long way to recognising that ultimately our drugs policy should be driven by reducing harm and saving lives. But returning specifically though, Madam Deputy Speaker, I can confirm that the Liberal Democrats support this measure to improve access to naloxone, and I thank the Minister for bringing it forward.
Jim Shannon.
Thank you, Madam Deputy Speaker. Can I thank all of those who have made maiden speeches and valuable contributions that they made to the Chamber. As a Democratic Unionist Party's health spokesperson, it's very important that I speak on this issue. And I want to give, as I always do in the Chamber, Madam Deputy Speaker, a Northern Ireland perspective. The perspective from Northern Ireland for the Minister and the Shadow Minister and for others who have spoken will mirror what happens in all of the United Kingdom. But I want to add my support for what the Minister is bringing forward tonight. There's nobody, I believe, in this Chamber could not see the benefits of what's been put forward. As members will be aware, this medication is a life changer, and the Democratic Unionist Party have consistently supported the ability of the PSNI and the ambulance service to administer Naloxone in Northern Ireland in this region. And the legislation before us today will extend this remit to further professions and staff, as well as conform necessary rules around storage and training. When I've talked to some of my colleagues and friends back home about this issue, they were very clear that we needed to address this issue, and this was a method of doing just that. The figures around opiate-related death in Northern Ireland are absolutely heartbreaking, showing that there were some 154 drug-related deaths registered in 2022. While this represents a decrease of 59 from the 213 drug-related deaths registered in 2021, I think we can all agree that this is simply too many. And whatever we can do to reduce that factor and that number and that impact upon all those families who would wish just to have something available that may save their life. Since 2012, Northern Ireland has seen deaths due to drug-related causes rise by 98%, from 110 to a peak of 218 in 2020 and 213 in 2021. The 2022 total of 154 represents a 40% increase on the number of drug deaths registered a decade ago. All these figures show a trend, a worrying trend, and I have to say that in my own constituency, I've in the last election gained some new territory in the boundary changes towards South Down, and the issues of drugs-related activity there is something that I find incredibly worrying, and those are issues that I'm taking up with community reps and indeed with the PSNI as well. And of the 154 drug-related deaths registered in Northern Ireland in 2022, over 2/3 were men, and looking at the number of deaths by age, the 25 to 34 and 35 to 44 age groups together accounted for some 56% approximately of all drug-related deaths in 2022. Each year, over half of the drug-related deaths have involved an opioid. Between 2020 and 2022, an average of 118 drug-related deaths each year had an opioid mentioned on the death certificate. The Minister mentioned homelessness, and just today in the provincial press back home, I think it was a newsletter that was in. I read it this morning before I left. They mentioned the increase in the number of homelessness people in Northern Ireland to have figures that we've never experienced in all those years, Madam Deputy Speaker. And I think the Minister's right to underline that issue because it isn't just something that's happening in London or Birmingham or Manchester or Newcastle or Glasgow or Cardiff. It's happening everywhere. It's happening in Northern Ireland, and those are who are looking for properties and for accommodation in Northern Ireland. And my constituency are at some of the highest levels we've ever experienced that I've ever seen in all my years as an elected representative, both as a councillor, as a member of the Northern Ireland Assembly, and latterly as a member of Parliament. The need for the appropriate use and storage of this medication, of course, which can bring people back from the brink. That's what it does. Brings them back from the brink, gives them a chance again to gain, hopefully, a normal life, is all too clear. And yet within this, I would also ask the Minister to outline that within the legislation and process, is there a protection for public health staff? Very important, Minister. I say this very respectively because I know the importance of this for the staff that I speak to back home. In terms of protection from legal liability for the administration of Naloxone, to ensure that staff do not fear stepping in but fully understand that their intentions in the circumstances to do good will come with a cloak of protection. So I asked that question quite simply because I think the people that I represent, and I know that the Honourable Member for South Antrim will speak shortly with his vast knowledge of health issues and will probably reiterate the same thing as well. I conclude, Madam Deputy Speaker, with this comment. It is terrible to understand, but the fact is that any time I speak to medical personnel about situations like this, they will say there can be no hesitancy to step forward for fear of repercussions. Many will wait to see if anyone else will step forward, and this is not due to a lack of confidence and ability or a mentality of I'm off the clock or I'm about to go home, but is of a deep fear that should their help not be successful, that they will face repercussions. And this needs to be clarified for those workers who will be allowed to administer this drug. They must always be protected whilst administering. Minister, I very much welcome what the Minister has brought forward tonight, Madam Deputy Speaker. I look very much forward to the endorsement of the SI and the legislation that's been proposed. I think there's a magnanimous support from all sides of this chamber, from all parties within this chamber, both from the Shadow Minister, from the Lib Dems, from my colleague, the Ulster Unionist, who will speak shortly, and indeed, I believe, from others who will make contributions as well. Madam Deputy Speaker, this is the right thing to do. Let's do it. Minister, I look forward to your response to the questions that I've asked. Thanks so much.
I call Shannon.
Thank you very much, Madam Deputy Speaker. Yes, alongside all the other parties who've spoken so far, I do welcome these changes. Naloxone saves lives. It brings people back from one of the most final, fatal, in many cases, mistakes people can make. It's a really important change to be making. However, I hope that these new regulations will be kept a bit more closely and continuously under review than just coming back to the topic in 2 years' time, as is mandated. Drugs policy must be evidence-led, and as we see, hopefully quickly, the benefits of wider access and more people having naloxone available to them in their work, it may be a good idea to look at this and see if we can widen this any further. I've been reading the very careful and evidence-based and considerate responses from a range of different charities, including Release, and it seems like there are quite a few groups of workers who I think ought to be able to use the first route, the expanded definition of which kinds of workers can easily access this and use it, rather than the second route, which is via kind of a second separately accredited provider of naloxone, rather than just them being able to access it themselves. As really says, I think one of the more simple ways to do this might be simply to make it a pharmacy available drug rather than a prescription drug, with some exceptions as we have now. However, I don't want to say not do this. I want to say do this and then review it and go further if you can. There are many, many groups of workers who will experience meeting people unexpectedly who are going through overdose more often than others in their daily work. There are also more people now working with people who will unexpectedly be going through overdose because of the prevalence, the wider prevalence now of synthetic opioids and other routes to becoming a victim of having an overdose of opioids than previously. These include student welfare workers, youth workers not necessarily involved in youth justice, local councillors potentially, nighttime venue staff, transport workers are not currently on your list, street cleaners, park workers. Once you see the benefits of the wider groups that you're talking about being able to access naloxone very easily, it may become obvious that some of these other groups ought to be trained and ought to be given really simple access to it, potentially just through pharmacies to anyone who asks. But like I say, this is not to quibble. This is I'm obviously restating quite a lot of the things that were said in the consultation, and I hope that you will just continue to look at the evidence and expand this as quickly as possible. Every life we could save with this, we should save, and the harm that can be done, I think, is minimal in comparison. Thank you.
Thank you very much, Madam Deputy Speaker, and I thank the Minister for bringing this essay to the House. As has been said, I think, by all contributors, naloxone has proven itself time and time again to be that life-saving drug that reverses that effect of that devastating opioid overdose. And that's especially important, as has been said as well. Those opioid-related deaths now make up the largest number of deaths of drug misuse across the UK, and as the member of Strangford has said, over 50% of those in Northern Ireland. So the purposes of these amendments, which I fully supported when I was Minister of Health in Northern Ireland, is actually to increase the number of services, professionals and organisations that can supply actually naloxone without prescription or even a written instruction. In June 2021, under the previous government, also when I was in post in my department, we actually agreed to that UK-wide public consultation on the proposed changes to the human medicines regulations, which actually sought to seek views on the viability of proposals actually to widen access to naloxone by expanding that list of services and individuals that can give it out without a prescription or indeed that other written instruction. And I do support the previous speaker's contribution when we need to keep that continually under review with the additional training to make sure that we can get naloxone into as many people's hands as possible so it can be administered at the right point and the right time. I thought then, and I still think today, that these changes are not just perfectly sensible, but they are ultimately a small legislative step that will have big and real life-changing consequences, and I'm glad to see that they've endeared support from across the House. Thankfully, the consultation that was held actually indicated that there was strong support for each of these proposals, and that included those who responded solely from that Northern Ireland perspective. Madam Deputy Speaker, Minister, the evidence is clear that there have been countless lives saved as a result of naloxone, and I'm confident actually that today's changes will help prevent further people who use drugs from sadly losing their lives to that use.
Minister Karin Smyth.
Thank you, Madam Deputy Speaker. And this evening I am standing in for my honourable friend, the Public Health Minister, who couldn't be here. And I might offer to stand in again, such as the rare outbreak of unanimity across this House. I think that's often the case in public health measures from my own experience in the sector, because so much work is done in the background, and I think there is broad agreement about the need for prevention and the great work that has been done before. And I think those comments, I really thank particularly the opposition spokespeople for their support this evening and their comments. And I think that is testament to the work that has gone on by officials and previous administration in getting us to this point. The consultation was very well received. Can I also add my support to the comments from the opposition spokesperson about recognising World Suicide Prevention Day. Suicide, particularly amongst men, is something that has affected most families, I think most of us, and it certainly has affected many people in this House, and he's right to raise those issues. He particularly asked about training, and the training and reporting are part of the legislation. There will be training and data reporting requirements attached to this measure. The training will be required to meet some broad objectives: safe administration of the drug, of Naloxone, safe storage, and how to train someone else to handle and administer it safely. Training on the use is already well established in most parts of the country alongside Naloxone provision, and each product has its own established training set out by the manufacturer. I hear the professional words that he has raised. If he has any further requirements on that, then my honourable friend will be absolutely happy to write to him on that. I think other excellent points made about looking at keeping under review, which absolutely we will be doing, and I think the Honourable Lady from Brighton Pavilion kept those her points well made, and they are now on the record. The government will be looking to go across all sectors of the government on its prevention strategy, including Justice, the Home Office, MCLG, DWP, Education, to have a preventive public health-led approach to this issue. And I'm sure my Honourable Friend will be back in front of the House on that in the future. And again, I welcome the Honourable gentleman from South Antrim for his expertise, both in Northern Ireland, but also bringing that back into this House for this debate. I'm sure this will be coming back before people in the future. So, Madam Deputy Speaker, to conclude, in short, these changes will widen... I will.
Madam, I'd asked a question. The question was for those medical staff who administer the Naloxone, that if they're doing it, I understand, and I've just been reminded of it by the Honourable Member of South Antrim, those who do it out of their job but still do it because they have the expertise, that they're covered to ensure that they feel that there be no comeback against them. I asked that question in my contribution, looking for an answer. Thank you.
And I understand that there are some concerns about that, and we'll make sure that he has a full answer to that from my honourable friend. In short, the changes will widen access to life-saving medicine, and I'm sure honourable members will agree that any death from an illicit drug is tragic and preventable. So I'm pleased that we are taking this step, and I'm pleased to have the support of the House for that this evening in reducing these drug-related deaths. And on this basis, I hope that honourable members will join me in supporting these important regulatory changes, and I beg to move.
The question is, as on the order paper, as many as are of that opinion say aye.
Aye.
Of the contrary, no. I think the ayes have it. The ayes have it.